Can I ask a sort of obvious question? What is social policy?
And it's interesting you're asking that here at the annual conference of the Social Policy Association, because it's a question that's been asked in at least 2 of the sessions that I've been to. I think a lot of people both studying social policy and seeking to implement social policy, as they were doing social policy in the world, would say that it's about promoting welfare and well-being. It's about how we make the lives of all of the citizens in our country, how we make it possible for them to live safe, fulfilling, healthy lives, how we make it possible for them to achieve what they want to do within their lives. And that's often captured in this notion of welfare and well-being. So what we're studying when we study social policy is we're studying how we deliver welfare and well-being to people. What that turns into in practice actually is a number of different ways in which we conceive of the issue of welfare. What do we mean by it? For example, it presumably includes health. What do we mean by good health? Can we define health? Can we measure health? And then what do we do to try and promote good health? So you end up then moving from the very general notion of what you study to look at particular aspects of policy development and policy delivery. So in a social policy student will study things like the National Health Service, how it's developed, how it's changed, how it operates. They will study education systems, the role of education for school children, and then how education is taken forward into later life, what they call these days lifelong learning. Increasingly important to recognise that education isn't just something that happens to kids at school. They would study how we provide for people's material needs, how we provide for housing, how we provide transport and other environmental factors. And of course in particular how we provide people with the wherewithal to meet their own material needs. In other words, the question of the distribution of resources, particularly cash resources, people's incomes, the social security that can help to support or replace the incomes that they might lose. So we study those different policy areas and how they're implemented and how they've been developed and how they're implemented in practice. And then, of course, when we're studying that, there's often an assumption, I think, particularly when people start out studying social policy, that you're mainly then looking at what the state and the government does. In other words, social policy is about delivering welfare for citizens, and it's the government that does that, and they do it predominantly through the public agencies like the National Health Service. But actually, of course, when you begin to look at how social policy is played out in the world, it's not just what government does that makes us, contributes to our welfare. Our welfare is developed and is improved and is enhanced by a range of different agencies, which includes private and commercial agencies, providing, for example, providing us, the people who make the glasses that we wear to help us to see. The different, a wide range of voluntary and community agencies who contribute in a number of different areas, including much of the provision of social care for people who can't look after themselves or who need assistance in looking after themselves are provided by voluntary agencies. So it's what we do on a voluntary basis for each other. But also, actually, and probably the most unsung area is what happens informally, in informal relationships between individual citizens. And an awful lot of our welfare we actually do on a more or less face-to-face, certainly person-to-person basis, and of course in particular through the family and the importance of the family and different family structures and different family shapes that aren't all the same, but the role of those informal relationships. So it's not just about what happens in the NHS, and indeed it's not just about what people in government and policymakers say. The implementation of social policy covers a wide range of relationships that start perhaps with the formal and governmental, but also include the informal, the family, the community, the voluntary, and so on.